Medicare Made Easy. This is your guide to navigating Medicare choices and finding the right coverage for you. Medicare is the federal health insurance program for people 65 and older and others with disabilities. You are eligible for Medicare if you are a U.S. citizen or legal resident for at least 5 consecutive years, and you are age 65 or older, or you are younger than 65 but have a qualifying disability, or you have been diagnosed with end-stage renal disease or ALS. Medicare coverage is divided into 5 parts: A, B, C, and D, and Medicare supplement plans called Medigap. Parts A and B are administered by the federal government. They are also known as Original Medicare. Part A covers hospital stays, other inpatient care, some home health care services, and hospice care. You must meet a deductible before Part A begins paying a share of the costs and co-pays for various covered services. There is usually no premium. If you have to pay a premium, you may be able to get state assistance. You can't be refused Part A coverage because of your medical history or a pre-existing illness, as long as you are eligible for Medicare. You can choose any qualified provider in the United States who accepts new Medicare patients for Part A coverage. Part B coverage helps cover outpatient medical services, including doctor and specialist visits, preventive care like flu shots and mammograms, lab costs, physical therapy, medical equipment, mental health care, and more. Part B coverage has a monthly premium that is based on your annual income, and you must meet a deductible before it begins paying costs for various covered services. After you meet your deductible, Part B has co-insurance. There is no limit to your out-of-pocket expenses with Part B coverage. Medicare Part C coverage, also called Medicare Advantage, is optional private insurance. A Medicare Advantage plan combines Part A and Part B coverage with additional services that often include emergency and urgent care, vision, hearing, dental, health and wellness, and prescription drug coverage. With some Medicare Advantage plans, you choose a primary care physician. In other plans, you can go to any Medicare-eligible provider who accepts the plan's terms, conditions, and payment rates. Medicare Advantage plans have service areas and offer nationwide emergency coverage. The Medicare Advantage plan you choose may or may not have an additional premium. Some plans have deductibles, and many have co-pays or co-insurance. All Medicare Advantage plans limit your out-of-pocket expenses. Medicare Part D is optional coverage that helps pay the cost of prescription drugs. Part D is included in most Medicare Advantage plans. To see if your prescription drugs are covered before you enroll, check the list of medications covered by the plan and approved by the Centers for Medicare and Medicaid Services. This list is called a formulary. Some Part D plans limit your choice by area. Others offer nationwide coverage and even mail order service. Part D premiums vary by insurer. Some have deductibles, some have co-pays, and some charge a percentage of the cost. Most Part D plans also have a coverage gap, during which the plans may not cover some of the drug costs. Medicare supplement plans, called Medigap, are private plans that cover some or all costs not paid by Parts A and B. They can help cover deductibles and co-insurance. Medigap plans do not include coverage for prescription drugs, vision, hearing, dental, or health and wellness programs. You can choose a Medigap plan from any qualified provider in the United States who accepts new Medicare patients. Premiums vary by the insurer. If you'd like to learn more, go to iuhealthplans.org/Medicare Made Easy to request the free comprehensive Medicare Made Easy guide, or contact us to request a personal consultation by calling 866-283-4973.